Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, and today is another of our Facebook Live updates. This is a chance for you to ask questions, and we're going to do the best we can to try to answer them. I'm not sure we have lots of answers tonight, but we'll try the best we can. If you have questions, please put them in the chat section, and Vanessa will get them to me tonight, and we'll see how we go. So, as we always do, we start from the top and go down. So in the world, still very active pandemic. 96 million cases and 2 million deaths. I mean, 2 million deaths is just a stunning number. The number of new cases in the world is starting to fall. I think it's peaked and it may be starting to fall, but the daily deaths are still increasing as we get to a few weeks after the rise in cases. You'll remember what we say is gatherings are followed by cases are followed by hospitalizations, and hospitalizations are followed by deaths. Now, clearly not all of them. Every gathering doesn't lead to a case. Every case doesn't lead to a hospitalization. But the peak in those things tends to follow each other. In the U.S., we're about 25 million cases. It's pretty devastating. And depending upon who you look at on the death rates, and there's a couple of different sources. There's the COVID Tracking Project, there's the New York Times, there's the Johns Hopkins, and there's one called Worldometer, which is the one I typically use because it compares the world on a Greenwich Mean Time day. And that shows that the U.S. has had 411,000 deaths. Johns Hopkins is a little less, but it's about 400,000 deaths. That is a lot of deaths related to this. Again, if you'll remember, the leading cause of death in the U.S. is heart disease, causes about 600,000 deaths a year. This has only really caused death over the last 8 months. So since this really started in May, this has been right up there with heart disease as the leading cause of death. In the world, still very active in much of Europe. So we start to see Spain and the UK having a lot of cases, France and Russia also with a lot of cases, but it's still very active in Brazil. It's been active in Brazil since July. And when you think about Brazil, it's an equatorial country, very warm. And so not a lot of seasonal change, and yet they continue to have high numbers of cases. Very quiet still in Argentina, New Zealand, and Hong Kong. A few cases in South Korea and Japan, but really centered mostly in Europe, South America, and the U.S. In the U.S., still a very active pandemic, again, around 25 million cases and 400,000 deaths. And when we look at where the disease is most prominent in the U.S., it really is the big states. California, Texas, New York, and Florida are the places have the most cases and the most deaths. California, especially Southern California, is really struggling with the number of cases. When you look at the number of cases in the U.S., I think it peaked about a week ago. So when you look at the daily new cases, peaked about a week ago and is now beginning to come down, but still is a really high level. Again, because deaths tend to follow cases, I think deaths are either stable or may have just hit their peak. Hospitalizations, another thing that I follow carefully because it's the smoothest data and the most accurate data, has also shown a decrease. So I think you can say throughout the country we either hit the peak or we're a little past it. Oregon continues to do reasonably well. The numbers in Oregon have been up and down, so it's a little hard to tell. We're at 134,000 cases and 1,800 deaths. I think the case rates in Oregon peaked again in the middle of November, had a little peak in the beginning of January, and then came down. And Douglas County is the same thing. So again, we had a little peak in November, another little peak in the beginning of January, and again, we're starting to come down. The last 3 days, we've had a relatively low number of cases. And when you look over the last 14 days, we've had a lower than 200 case rate. I think if we can continue this good over the next week, next Monday, when they look at the data over the next 2 weeks, I think we're going to stay out of the extreme range, in the high range, and continue to allow businesses to be open. Again, I point out that Douglas County is one of the few places in the state where businesses like bars, restaurants, and gyms are still open. And again, Douglas County has one of the lower rates of disease. All right, let's see what kind of questions we have here. All right, so we'll talk about a few things. One is testing. Testing has switched over the last few months. The testing used to be the deep nasopharyngeal swabs that would do a PCR test, take a few days, sometimes a week to get back from the lab. Very accurate, but expensive and kind of uncomfortable to do. The new ones now are the little ones that go in the anterior part of the nose. These are antigen tests. They look for the protein that's associated with the virus. These are considerably quicker to do. You can get the results in about 15 minutes. They're quite cheap. They can get less $5 a test, and you can get results in 15 minutes. So we're trying to move away from the PCRs to those rapid tests so we can get a much quicker view. And then the other thing is about the vaccine. The vaccine is here and it's out, and I'm sure we'll get many questions about that today. One of the other questions that comes up is about the variant virus. So their viruses change, and they change with time, and as they change with time, sometimes they get stronger, most times they get weaker, but the ones that get stronger do tend to separate. So I've been trying to think of the story that would explain how mutations work and why some mutations spread and not. So this is the story that I have. Imagine if you were in a group that got recipes, you looked at the recipe, if you liked it, then you sent it on to 5 friends. The 5 friends would make the recipe. If they liked it, they would copy it and send it on to 5 more friends. And that's sort of how viruses and bacteria work. Their job in the world is to stay alive and to spread. And so the better they can stay alive, the better they can spread, the better they survive. If obviously you could kill every bacteria, then there would be no more bacteria around. And so the job of a virus is to escape detection and to keep going. So imagine that you have this cake recipe, and the cake recipe calls for the normal things that are in cake. And one of the things that it calls for is a teaspoon of vanilla, not an unusual ingredient for it. So that you make this cake and do it, and then people they kind of like it, and you send it to 5 friends. Well, one friend, when they copy it and they spell vanilla wrong. Well, that's what we could call a nonsense mutation. That might get carried on in future things, but it doesn't really affect the cake at all. Now, someone may miscopy it, and instead of having a teaspoon of vanilla, they put a teaspoon of Tabasco. The people would make the cake and taste it and say, oh my God, that tastes terrible. And they would not eat that cake anymore. And that recipe then wouldn't spread to others, just like a mutation which made the virus die off quickly or whatever wouldn't spread. But let's say that one of those mutations would be to add 2 teaspoons of vanilla rather than 1. And then when you taste the cake, you say, that's the first cake was good, but this one is even better. What would happen then is that survived well would get spread more, and then after a while the cake recipe with just a single teaspoon of vanilla would kind of die out, and the one with 2 teaspoons of vanilla would do better, and it would spread quickly. Now, if you had a lot of spread quickly, imagine where you had a bake-off with 1,000 people in a room, and they were all spreading recipes. If you got one cake recipe that was better than all the others, it would spread very quickly through that group, just like mutations spread very quickly in a mink farm, and that's why we worry about mutations. Now, the worry about mutations is that if they are more contagious, as both the 614 mutation and the 501 mutation appear to be, that's dangerous because this is more contagious, it spreads to more people. Neither of these appear to be more deadly, but more contagious means more cases, and more cases does mean more hospitalizations and deaths. The second concern we have, though, is the vaccine going to work against these new mutants? And we don't know the answer to that. We think it will, but there are some mutants out there that we're not sure about this. There's one particularly scary about the mutant virus, or the variant virus in California. So emergency department around Christmas time, a guy apparently gets dressed up in one of those Christmas tree suits. You've seen them. They have these little blowers and you get blown up. They're usually sumo wrestlers or whatever, but this one apparently was a Christmas tree. And apparently one person who was ill spread it to 90 others, and the 90 others, emergency workers, made it very hard. And I mean, that's a lot of spread. It was found later that this may have been one of the variant viruses. So that is a really big concern if we get a vaccine that spreads that much. I mean, we've seen 20, 30, 40 cases, but 90 cases from the single waltz around the ED is really incredibly worrisome. All right, let's see what we got here for questions. Okay, so most questions I bet tonight, I haven't looked at these yet, are going to be about vaccines. Loretta says, how is the J&J vaccine going? What about the new Oxford machine? I'm allergic to shellfish and want to know what my options may be. So what we have noted from this vaccine is about 1 in 10,000 people has a severe reaction to the vaccine called anaphylaxis, where they get swelling of the throat and hives. It's really pretty scary. It's pretty rare at 1 in 10,000. But seems to be more common in people who were, seems to be more common in people who have previous allergies, especially allergies to sulfa, but also to previous vaccines or to shellfish. We don't know if it's something specific about this type of vaccine or just when you give that much vaccine this quickly to this many people, you will see it. So some people who are severely allergic might say, well, let me see what the new vaccines are. Well, there are 2 new vaccines, the J&J vaccine, Johnson & Johnson vaccine, made by Janssen Pharmaceuticals. Data came out this week. The data was in animals and in humans showing neutralizing antibodies. It looks really quite promising. It is made with a weakened human adenovirus. The Oxford vaccine is made with a weakened chimpanzee adenovirus. So there are a number of options out there as to which you'd get. Yeah, you might wait to see what's going on. There was good data today suggesting that the J&J vaccine might have some early results and may go for emergency use authorization soon. And that would be good because one of the big concerns we have is that there's not enough vaccine. And while Moderna and Pfizer are making it as fast as they can turn it out, having another vaccine would just be another tool in the toolkit, and we would look forward for that. So John says, I received my vaccine but didn't get a vaccine certificate. So during this whole epidemic here, we have run into some kind of earth-shattering little thing. So early on, you remember when we want to do the test, they needed to be put in saline or salt water. And we tried to get a local manufacturer here, one of the pharmacies here to make it for us, and it had to go all the way to the head of the FDA to allow them to put salt water in bottles. Just crazy. The other thing that we're short of are these Q-tips to do the nose. They are skinnier than usual Q-tips, but they're really Q-tips. And so we spent weeks fighting around for Q-tips. What's happening now is they send the vaccine out with what's said to be 100 doses in the box and with 100 vaccine cards. It turns out that many of them have more than 10 doses in them, so sometimes you get 11 or 12 doses. So now you really have 120 doses here, but still 100 cards. So what happens is we run out of the cards. So these are really just cards. And so we said, well, those would be easy. We'll just call the CDC and get more. You can't. Call the state and get more. You can't. Print them up. Really not easy. So actually my wife spent a long time yesterday figuring out how to get them printed up. And so we printed up a bunch yesterday. Now it turns out that in Oregon, all of these are in the Oregon Immunization Alert, a computerized database. And we don't give kids shot records anymore. You used to fill them out on those little yellow cards. People lose them. They're hard to read. They smudge. Far better to have it in this registry, which is backed up multiple ways, and you can do that. So if you can talk to people who did it, we, as I said, made up those cards yesterday. I was working on the cutter yesterday, cutting them up. And so we have additional cards, so you can go back and you get it again. So kind of funny. So someone says, do you know of any business in our county that are mandating the vaccine? No. My employer is, and it concerns me. Well, I'd be interested to know who your employer is, and you can just do it anonymously because we don't think that there are any employers yet that are mandating it. I don't think there's much appetite in Oregon for mandating vaccine. This whole pandemic has been so heated and whatever, and you really don't need to do that. Everybody doesn't have to get vaccinated. There may be, for example, Loretta, who's so severely allergic to shellfish that she's worried about the vaccine. That's okay. There may be pregnant people who don't want to get it because it's not adequately studied pregnant people. That's okay. Because if the rest of us get it, then that'll be it. So if you could send who that business is, I'd be interested to know. So Monica says, my son is 21, has CP. Where can I get him vaccinated? I hear he is eligible now. He should be eligible now, and he should work through his case manager. That's why I was sort of a little-ish late today, because I was working with that today. So Karami says, when does the 2-week period start, or was it last week? So we're right in the middle of the 2-week period. It ends this Saturday night. When I looked this afternoon, we were at exactly 200 cases per 100,000. So we're right on the borderline now. We would hope that our number of cases continues to decrease, because if it increases, we're going to wind up going back to the extreme stage, and that would just be miserable. So how safe is the COVID immunization, Tina says? Well, so what we know is that the COVID vaccination was given to a large group in both the Pfizer vaccine and the Moderna vaccine. There were no serious safety things seen. Since then, it's been given to millions of people in the U.S. There have certainly been some allergic reactions. About 1 in 10,000 people have a severe allergic reaction. Although everybody's gotten it, has survived and done okay. There are a couple of deaths associated in time with the vaccine, but none really tied to the vaccine, right? So there's lots of things that happen every day. People my age have heart attacks, they get cancer, they die of all kinds of things. And if I died of a heart attack, if I had a stroke, say, and I had not gotten the vaccine, I would say, geez, I don't know why I got the stroke, and I'm older and had some high blood pressure, so maybe that's the reason. However, if I'd gotten the vaccine 10 days ago, I may say, yeah, I was feeling great, but I got that vaccine 10 days ago, now the stroke. Maybe the stroke is related to the vaccine. And that is not unreasonable to think, and that's why we have to carefully look at this. Now, if we see that people who've had vaccines have a higher incidence of one kind of problem or another, that would then suggest that it was related to the vaccine. On the other hand, if the people who didn't get the vaccine have the same level of stroke, then it's probably not related. But this is really hard. I think it's safe. I think it's actually very safe. Actually, most vaccines don't get tried on nearly this number of people. Most new meds that come out get tried on a few thousand people, not this number of people. So I think this has had a lot of scrutiny. I think this was very well done. I think this is a very safe vaccine, and I think this is our way out of this pandemic. Yeah, so what about dogs and cats and COVID? So dogs, not so much with COVID, but cats very clearly get COVID, especially the big cats, lions and tigers. Not bears, but lions and tigers get this. I looked last about the stuff. They seem to get sick, but not super sick from this. Mink also seem to get sick from this. Some of the mink do die. But we don't know if animals are going to be carriers of this, or are they going to have long-term damage. I mean, if they did, let's say possums, which is sort of similar to ferrets, would be carriers of this. It would be then really hard to get rid of it in a population. So far now, there's no evidence of that. Although there's some wild mink. So they're around mink farms. They assume that some mink are going to escape. And so they capture wild mink around farms, and a bunch of those have been positive. So, that's a real worry, because if this disease gets into an animal population, it'll just make it that much harder. Do you still think grocery shopping is low risk? Yes. So I think grocery shopping is a relatively low risk activity if done correctly. And if done correctly means that you wear a mask, you go to a store where most people wear masks. The store I go to, most people wear masks. You go at a time that it's not crowded. You avoid crowds. There's a line at the butcher, and that's where you want to go. You stand back until there's not a line. I think if you do that, it's very safe. Grocery stores tend to have excellent air handling. You tend not to be around any one person for a long time. And many of the places you can do self-checkout, or the checkers are all behind plexiglass. So I think it is a relatively low-risk activity. We have looked. We haven't seen a lot that grocery stores are a source of infection. People say, well, what about, how's that different from a bar? Well, again, in a grocery store, you go, you stay distant, you wear a mask the whole time. Whereas in a bar, just because it's in a bar or a restaurant, you tend to sit closer, you tend to take down your masks, you tend to be with one or a group of people for a much longer time. So can you explain if the new variant is in Oregon and why it spreads much more easily, Beverly says. So yes, there are 2 variants in Oregon. The one variant that got here was the 614. That got here back in April. So really pretty much all the disease in Oregon has been the B614G variant. What that did if you think of the surface protein as being like a stick, and it used to have a little place where it frequently broke. The 614 variant made that much stiffer, and so it broke less. And because it broke less, more of the virus survived and more of the virus could infect you. This new one changes the affinity or the stickiness to the receptor protein, so it sticks more, and because it sticks more, you're more likely to get infected. We think it's about 50% more spreading because it just sticks to the receptor more. I mean, when you think of the way this works, viruses have viruses don't have any muscles or legs or things to move them around. They just kind of float around. And because they float around, they bump into things. And you can imagine that if you were going to bump into something and had a much stronger magnet and the thing was metal, you'd stick a lot more than if it was a weak magnet. So this is just a stickier receptor, and it binds to the receptor better, and that's why we think it spreads more. So Crystal says, our office is waiting on a vaccine. We're an optometry office. When did we get one? So if you're in Group 1A, healthcare workers, first responders, people who live in nursing homes or memory care facilities, if you put your thing into vaccines at douglaspublichealthnetwork.org, again, the word vaccines with an S, at spelled out, douglaspublichealthnetwork.org, one of the people who's working on this, and we have a group of people working on this today, trying to match up people who have vaccine with people who want vaccine. And so please put it there. So Senator Geiser talked about additional doses of Moderna today. There's a lot going on with that. We are able to get 1,500 doses of Moderna this week, which is far and away the most people get. In fact, it's almost twice what we've gotten total in the past. And so there's 1,500 doses, and I think we're going to be able to use those very quickly. And so, yeah, we've been able to get every opportunity. I'm a total pain in the neck, I'm sure, people at the state. All Saturday morning, my phone was buzzing about getting additional doses of vaccine. So I think we've done okay here. So Zach says, give an update on the case numbers going to extreme risk category. So the extreme risk category is when the case rate in a county is above 200 per 100,000 as counted over the 2 weeks, the two morbidity and mortality weeks. I also calculate every day just because I want to know what the number is. And today we're just at 200. So we were under 200. We were under 200 on the last day, just under 200, like 199. We then went to about 211 last week. And today I saw we were down right at 200. So again, what we need to do, what we need to do is just keep the case numbers down. And there's no magic here. It's still gatherings. It's still wearing a face mask. It's still staying home when you're sick. We have seen more and more of our cases over the last few weeks, people who were sick and then go back to work. In fact, we had one person who did a slow test. They were sick. They did a slow test. They went to work for 3 days, and then the test came back positive. So really, if you're sick, you got to stay home. Really, you should avoid the big groups, and that's how we're going to avoid going to the extreme risk category. I mean, for gyms, for restaurants, for bars to have to close again is going to be absolutely disheartening. So what is necessary with the vaccine to move from emergency use to fully FDA approved? Well, the full FDA approval process takes months or years. They need to submit an application. I get the sense that they're not going to do that for a while because they have some benefits being on emergency use. And so under emergency use, there's a liability protection. And so I would bet you're not going to see them go for full FDA approval, but I don't know. So Lorena says, I heard you say to get a test 5 days after known exposure. Today, a clinic told me CDC recommends 7 days. It's 5 to 8 days. The very best day if you want to get just a single test is on the 7th day, but anywhere between the 5th to the 8th day is acceptable. What I wouldn't do is to do it anywhere before the 5th day, because if you do it before the 5th day, you're likely to get misleading things. So let me suggest. So I get exposed on Sunday. Go to a party, somebody else is there. They say, Bob, the next day I tested positive. So Monday's the first day, Monday, Tuesday, Wednesday, Thursday, Friday. If I got tested on Thursday, my test would almost certainly be negative, even if I was infected. Friday would just start to become positive, and the optimal time, if I really want to know, is going to be 7 days after exposure, so it would be that next Sunday. So Shannon says, according to the OHA, Douglas County has the lowest vaccination rate in the state. Yeah, that is true. It is true that we're one of the lowest. We're not the lowest, but we're one of the lowest. And we're one of the lowest for a few reasons. One is because we've had a low rate of disease. We've not been a priority county. Marion County, which we talked again and again and again, has had the highest rate of disease has had a lot of cases for a long time. And they've been the highest priority. And you hear about all the things at the Salem Fairgrounds. Portland has also really been a mess, and they've gotten a lot. Umatilla has been a mess, and they've gotten a lot. Douglas County hasn't been a mess, so we've gotten a relatively lower number of vaccines. We are tracking the dispersed vaccines. We checked today. Of all of the vaccines that were dispersed to Douglas County, we think there are only 248 that have not been given as of today. So of all the ones I've gotten, so Mercy got a bunch, Lower Umpqua Hospital got a bunch, EMS got a bunch, Public Health got some, and of that we think they're fine. And of those, they're going to be dispensed by the end of the week. Yeah. So again, Stacy's follow-up question: how does Douglas County compare to other counties in the number of vaccines being provided? Again, the vaccines are mostly now going to places that have really struggled. They have these big events in those areas. Douglas County has not struggled, and so we've gotten relatively fewer doses. It's going to get straightened out over the next few weeks. Really, truly, there was so much troubles in the Salem area that they put a lot of effort in bringing in the National Guard, using the state fairgrounds to go ahead and do a big event. We're going to do an event this weekend. That will increase our numbers. And again, as I said, we got 1,000. We're going to get 1,500 doses this week. Just this afternoon, 1,000 of those were delivered, and again, those are going to be mostly used up by the end of this week or early next. So can COVID be spread on paper? So this is always interesting. When you look at viruses and bacteria, they can live on different surfaces, and people seem to be obsessed with like how many bacteria there are on doorknobs or on the wall or whatever, but we don't think that for respiratory viruses this is all really that important. I mean, you would have to have it on, somebody do it, have it on paper, live on the paper, then you would have to touch the paper and then touch your mouth or your eyes or your nose. So we do not think, while we think theoretically possible, we don't think that this is a likely place for spread. Far more likely is that people in a group, they're singing. There's virus in the air, people breathe that air and they get it. People are in an emergency room, guys in this blower costume that's blowing his stuff everywhere, and he gives it to people. That's how we see it spread. We don't think we see much spread on inanimate objects. So are we still aiming to start vaccinating teachers, support staff, admin, and bus drivers starting the 25th of January? Yes. So we are hoping that we'll be able to get mostly through the 1A population by January 25th and then move on. A couple of issues. One is we really haven't gotten that much vaccine, and we think we're going to need more vaccine. We're going to need much more vaccine to get this done. The second is that people keep saying, "Oh, I'm in 1A," although they're clearly not. When you read the guidance, they say they're in 1A. So every day, another 500 people say, I should be getting the vaccine in 1A. And very clearly, when you're only getting 1,500 total doses a week, adding 500 a day from this group, I had a group today of 1,000 that said they should be added. It's going to be really, really hard to know. But our goal is to start getting to teachers, support staff, and bus drivers starting next week. Now, I don't know how it's going to go. There's still a lot of time between now and next week, but that is our hope. So Mary says, I'm 85 years old and no spleen. Can I get the vaccine? Yes, you can. The goal right now is to start people who are 85 and older this weekend, 85 and older starting on February the 8th. So on February the 8th, we're going to start doing people 85 and older. But that depends upon getting enough vaccine to finish up the 1A group and then to finish up the teachers, and then it would be the 85-year-olds. And in this state, there's been this enormous battle about, do teachers go in front of 85-year-olds or do 85-year-olds go in front of teachers? And it really has brought out the worst in some people. It's really brought out the worst in some people. Because both of them need it, right? So it's a little hard to judge. Do you love your kid's teacher more than you love your mom? It's sort of hard to figure those things out. Oregon's sense has been that we need to get kids back in school. To get kids back in school, we need to have teachers get protected, because teachers have to be in the classroom with nobody else in the room being vaccinated. And we know, especially if you teach high school, just as contagious as anybody else. So we're not asking anyone else in society to be in a room for 5 hours a day with unvaccinated people who could spread it to you, right? So, I'm doing practice. I'm in the room for 15 or 20 minutes at a time with a couple of people. We're trying to do as much by video. But if you said, Bob, you need to go ahead and be in a classroom with 20 or 30 11th graders who spread this perfectly, some of whom might have the disease, and I'm at an age where the disease would be a risk. That's been the issue. That's been the reason we want to do teachers and do teachers first, so that we can get kids back in school, so that we can have some semblance of the school year this year. If you did 85-year-olds and then down to 65-year-olds and then people with underlying conditions, teachers wouldn't get vaccinated until May, and we would lose this whole school year. And I think that was the calculus for doing it. But it has brought out a lot of between 85-year-olds and teachers. But anyway, the goal would be to start doing people 85 on February the 8th, and we hope if enough vaccine comes along the way, we can do that. So Linda said, I heard that if a state doesn't give all the vaccines given, we won't get any more. Yeah, so that was sort of a threat from HHS, and that's gone away. They're going to continue to give it this way. There are some vaccines in Oregon, because Oregon has been very careful about holding the second vaccines for people who need the second vaccine. And so, for example, if I got the vaccine on January the 1st, that second vaccine for me would arrive at, say I got the the Moderna vaccine, it would arrive to the place that gave me the first one 3 or 3.5 weeks later. It would then have to sit until I came in to get it, and that's some of that number. In addition, there's the small number issue, right? When you use these vials, you can't use them and use 3 today and 4 tomorrow. You have to use the whole vial. So what's happened sometimes is people want to give the vaccine. They only have 3 people there to give it that day, and they say, well, we're going to need you to bunch you up with 7 people tomorrow to do it. So it's much more complicated in that way. And I think that's the reason they've gone to these mass events, because when you go to the mass events, there's thousands of people there, and you don't have to worry about wasting little bits of vaccine. Stacy says, who's eligible for an event this weekend? So this weekend, we have been asked to reach out to difficult-to-reach populations in 1A, and the difficult populations to reach were determined to be those with developmental disabilities and their caregivers, home care workers, that is, people who go into the homes of people who are disabled or otherwise unable to care for themselves. They pose a tremendous risk because they tend to have many clients, and they tend to be young people, not all, but many of them are young people who have lives of their own, and we've seen numerous outbreaks where a young person who's a home care worker goes in and then infects all the disabled people at home. So they're a high-risk group. Long-term care ombudsmen, these are people who go into long-term care facilities to be sure that things are being done correctly. And then people who drive, people who have COVID. So there are people who have COVID who need to get to appointments and whatever. Their drivers need to have protection so that they don't get sick, right? Because you're sitting in the car, even though you're wearing a mask, sitting in the car. So those are the high-risk people. They have been invited to this event this weekend. We think we're going to have somewhere. So we've gotten 500 doses, but remember I said you can sometimes get an extra dose or 2 out of the vial. So we think we're going to have about 600 people there this weekend. These are all people in 1A, and they'll do it. Now, in addition, if you are a 1A person and you want vaccine, It's vaccines@douglaspublichealthnetwork.org, and we'll try and get you set up with one of the clinics that has vaccine. So we had a call today with all the 38 vaccinators in Douglas County, and they've all agreed to give to other groups. So, for example, one of the practices, there's a center that takes care of sick people in town with cancer, and they should get the vaccine. And then there was a doctor who was going to get some dose of the vaccine, and they arranged to give them to them. So this is going to work. I think this is going to work. Again, if you're in 1A and you want a vaccine, do it at vaccines@douglaspublichealthnetwork.org. So do I think Roseburg School District will still be able to open Monday's plan? Yes. I mean, I don't think we're going to be above the level where they couldn't open, and I think they will. However, I will tell you, schools are a problem, and there's a lot of disease in the community. There are a lot of outbreaks in schools. So we had one or two yesterday, we had one today, and so you get a lot of outbreaks, and these outbreaks in schools tend to have a lot of contacts, right? Because they're in class with a bunch of other kids for a long period of time, and so you have a lot of contacts. And so there's a lot of work that happens when there are these school events. So will we hear about side effects of the vaccine locally? Sure. I mean, what I know of the side effects of the vaccine, we've had no serious side effects. We have had a number of people who had local side effects where they've had some itchiness, sometimes a funny feeling in their mouth. One person had pain in the back. One person had a localized rash on the arm. These are all mild reactions. They've all been reported to the VAERS system, but there's not much there now. We've only given 2,500 vaccines. I think it's best to look at the national numbers where there are now millions. So Karen says I'm 70 and allergic to sulfa. Yeah. So what CDC looked at reactions to the Pfizer vaccine, and people who were allergic to sulfur were overrepresented in the groups of people who got reactions. So I'd certainly talk to your doctor about that. A lot of it depends upon what your reaction was. Was it a rash later, diarrhea, or was it an anaphylactic reaction? If it was an anaphylactic reaction, it would certainly be some risk. So Patty says, I'm a hairdresser retirement home. Oh, that is a tough one where you fall in these categories. So if you work at a retirement home, the retirement homes are supposed to get their vaccine through the Federal Pharmacy Partnership, and you need to speak with the management at the retirement home because they should be allowed to have their contractors get vaccine with their staff. So that's going to do that. So Lauren says, I'm 77 years old and live in Reedsport. How and when can I get a vaccine? So we think in Reedsport, the major distributor of vaccines is going to be Lower Umpqua Hospital. Again, for somebody who's 77, we think that 85-year-olds are going to start on February 8th, and we think that 77-year-olds will start somewhere later in February. I don't know the exact date, but they'll start somewhere later in February. So it's somewhere at the end of February, and we would hope by the end of February that not only could you get a Lower Umpqua Hospital, we're also hoping that the pharmacies in town would have it too. So either the pharmacies or Lower Umpqua Hospital somewhere at the end of February. I hope that helps. Okay, well, while she's doing some more questions, let me go to a few more things here. Again, one of the things that I would point out is that the vaccines appears to be really, really good. So the data continues to be that you get about 94% protection after the second dose. Now the good news is you get about 80% protection 2 weeks after the first dose. So there's some talk about whether are we going to continue doing the second dose. I don't know the answer to that. The Brits have chosen to give the first dose to more people and then delay the second dose. Lots of discussion about that today. I am not sure how that is going to go. There was in California, there was one lot of vaccine that was associated with more allergic reactions in one of the sites in which it was given. So California said they were going to hold back on that. Turns out that lot was also distributed in Oregon. We've not seen any reactions to it here. We've actually given some here in Douglas County. We've not seen any reactions there. So where are we with our cases in our 2-week period? I said right now we're at 200 going day by day. So we'll see what happens. You know, we would like to we need to stay below 14 or so a day. So which vaccines have been given this weekend? So this weekend, there were 500 doses from Mercy that Mercy was not going to use immediately. So those 500 doses are going to get transferred, and it's going to be 500 doses of the Pfizer vaccine to be given this weekend. Yeah, so is there any hope of vaccine for those of us who are highly allergic to sulfa? Yeah, that's going to be a problem. Now, the new vaccines that they're considering, the Johnson & Johnson vaccine and the Pfizer vaccine, are both adenoviral vaccines, very different in the makeup. Usually viral vaccines, like MMR and chickenpox, have no immediate reactions, so it may well be that would be a better choice for you. But I think right now, for people who have anaphylactic reactions to sulfa, doesn't mean you shouldn't get it, it just means you should be cautious. And being cautious meaning that you'd want to do this in a place that's set up to go ahead and give you an epinephrine shot if you need it. That's the only precaution. If I was allergic to sulfa, that's the only precaution I would take. Probably wouldn't do it, maybe not do it in a drive-through. Now, one of the things that we've seen is that we ask people to wait 15 minutes after the shot, but when you look at the anaphylactic reactions, some of them didn't take place until after 15 minutes, and that's a worry about a drive-through also. You'd hate to say 15 minutes, I'm feeling fine, and drive out, and then have an anaphylactic reaction on I-5. That wouldn't be so great. So we're looking at that. Yeah, but I think sulfa is interesting because it's interesting. Anaphylactic reactions to sulfa, I think, are quite uncommon. I mean, I've been doing this a long time. We've certainly seen reactions to peanuts. We've certainly seen reactions to tree nuts. We certainly see reactions to latex. We see reactions to penicillin. We see reactions to eggs. And those are the kinds of things where you see reactions. I can't remember seeing an immediate anaphylactic reaction to sulfa. Yet, of the cases, sulfa was far and away the highest number. So there may actually be something with cross-reactivity between sulfa and this vaccine. Not sure what that would be. Again, remember, these little snippets of mRNA coated in a fat covering, none of which have any sulfa in it. So I'm not sure why this is. It may just simply be chance, but it's one of those things that we do want to be careful about. Let's see what else. The question we had is about new therapies. Now, we didn't talk at all about therapies today. So in the past, there's been a lot of interest in ivermectin. Ivermectin, which is an antiparasitic drug, which is used to treat heartworm in dogs and head lice in people. It's been around for a long time. It's seemingly fairly safe and effective. There's been a lot of controversial data as whether ivermectin is great. Anywhere from people saying it's a miracle drug to lots of others say it doesn't work at all. And so again, this is one of those things that we don't know that much about and for sure as to what to do. Another one is Luvox or fluvoxamine, which is a drug used to treat obsessive compulsive disorder. Actually does have a small but very interesting study suggesting that it helps to prevent progression. And then there's monoclonal antibodies. So monoclonal antibodies are these antibodies made in the lab that are antibodies against this, and they do seem to reduce the risk of hospitalization slightly. It doesn't do much for mortality, but seems to reduce the risk of hospitalization, and nobody wants to be in the hospital. So it may be useful. The problem with the monoclonal antibodies is they're hard to give. They have to be given in an intravenous infusion. It takes a long time. You're going to the hospital or to the infusion center while you're contagious. So it is a bit of a risk, and that one has been underused. Decadron still seems to be great. Hydroxychloroquine, still not very good data for that. Remdesivir is interesting. As more and more data has come out about remdesivir, it does seem to decrease hospital stay and does seem to reduce the time in the ICU, both good things, but has only a minimal effect on mortality. A little disappointing. We were hoping there would be other antivirals that would come out that would be developed in this short time, and unfortunately, we've not really had any other good antivirals that work. Then there are a number of immune modulating agents that people have talked about. And again, they started with a big fanfare about how good they were going to work. And they've really been a bit disappointing. So, Vanessa is typing here. Yeah, so the question is, could you mix these vaccines? Could you get Moderna the first time and Pfizer the second? The answer is we don't know. because it wasn't tested, right? So Moderna company did the Moderna vaccine, the Pfizer company did the Pfizer vaccine, and they didn't say, hey, let's see what happens if we swap over, because they wanted to get as many people done as quickly as they could. So they didn't do some of those things like the swap over. They also didn't do the, hey, what if you give the second dose 3 months later? Is that better than 1 month? Well, that would have delayed the trial by 2 more months. And so they did some things for speed's sake that then we don't have as much information. So we don't know. There are no recommendations out there to mix or match vaccines. In fact, there's a specific thing in there that says, please don't mix and match vaccines. Do we think it's going to be safe or whatever? So Bruce says, is there any hope of getting daily vaccine data? Well, the daily vaccine data is published. It's published on the state Tableau dashboard. Now, let me tell you, when you give the vaccine, how the data gets to the state. So when you give the vaccine, what happens is the data is put into something called the alert system. In some cases, it goes in there automatically. So for example, with the EMR that we use at Aviva, when you do, at night, it goes in there. And so if you give the vaccine in the day, it goes during the nighttime upload. Other places enter it by hand, and that can take 2 or 3 days. So for example, when the EMS are giving it, they're giving it and then entering the data later, up to 3 days later. And then there's a little bit of time for data scrubbing and that. So when you see that information in the data dashboard, you'll see that the last 3 days are shaded a different color, because the last 3 days are a little hard to tell because some of that data is getting in there. But if you look in there, you can find the exact number of people who were vaccinated by county, by day. And so the data is there. So yes, Bruce, the good news is we do have daily vaccine data to tell you what goes on. So you can get that. Again, it's on the OHA website, on the vaccine trends. On the vaccine trends, it'll give you both the data at the state and the data at the local level. Now, the state wanted to reach a goal of 12,000 vaccines a day, and they've pretty much done it. So the state has done a good job, but they've done it with these big drive-throughs in Salem and Portland. So they've gotten a lot of vaccines done there. Again, the little areas are a little later in getting the vaccine, and we're going to be doing that over the next week. So again, if you're in 1A, you think you want vaccines at DouglasPublicHealthNetwork.org, and we'll either set you up with a group that's given them, or in some cases we can actually give you a vaccine. So the question is, how much have we heard about the AstraZeneca vaccine? So the AstraZeneca vaccine was one of the first. So it was AstraZeneca, a big company that makes lots of vaccines, and Oxford University, one of the world's leading universities, and they came up with this vaccine. Was a chimpanzee virus. They have really, really good PR people, and so you heard a lot about the AstraZeneca vaccine early on. But there have been a couple problems. One of the issues with the AstraZeneca vaccine has been that they made an error in calculating how much vaccine was in a dose of vaccine that they gave to some people in the trial. And the thing that turned out is the people who got the lower dose of vaccine actually did better than the people who got the higher dose of vaccine. That doesn't exactly make sense. And it was a little worrisome that they made this dosing error. Second thing that happened is there were a number of safety signals. This doesn't mean there was a problem, but safety signals in the AstraZeneca vaccine, and they have never, at least to my satisfaction, been fully explained. And because of that, these safety signals and these sort of funny things that happen with the trial is going to make this one much harder to approve, right? Because when they approve things like this, people look for all the reasons not. There were like no reasons not to approve the Pfizer and the Moderna. There were no safety signals. These studies were conducted beautifully. They were big. They followed them for a long time. They had really good efficacy, and that everything they said made sense. And so those got approved quickly. With AstraZeneca, you're going to scratch your head a little bit why a smaller dose the first time and then a bigger dose the second time was better than 2 big doses. And tell me about these safety signals. The other thing is that much AstraZeneca's trials were done in other places too, and they have funny things there. So we're just going to have to see the data. I have not yet seen the data on the AstraZeneca trial. So Tracy said, is the Moderna vaccine 80% effective after the first vaccine? Yes, we think so. And so what you do is you do these curves of after the vaccine, how many people get the disease. And so it turns out in the first 7 days after getting the vaccine, both the Moderna and the placebo are exactly the same. So people get the virus in the first 7 days after getting it, and that's not surprising, right? Because you wouldn't think the vaccine would be effective in the first 7 days. So if there was a difference in the first 7 days, you'd worry that the data was screwy. But it happened just as we would hope, is that they were very close to the first 7 days. By 14 days, they start to diverge, and then they really diverge. Now, there were not a lot of people who got the disease after the first vaccine, but before the second. But it does appear that it's about 80% effective 2 weeks after the first dose. Now, again, not a lot of people studied because they tried really hard to get people to get their second vaccine. But, the Brits have said, yeah, it looks to be pretty effective after the first vaccine. Let's give it to more people, because if you have 1 million people, 80% protected, you will go ahead and have 800,000 people protected. If you give it to 500,000, holding back the second dose, and it's 94% effective, you'll get about 470, 480 that are protected with the same amount of vaccine. And so, they're saying it would be better to give it to more people and do the second dose. But there's a lot out there, and I don't know what's going to happen. Right now, the FDA, CDC, ACIP, Oregon says give that second dose, but who knows if that will change. There's also been a talk about giving a lower dose, because when you looked at the lower dose Moderna vaccine, the lower dose Moderna vaccine was almost as good as the higher dose. So the dose that's in the Moderna vaccine is 100 micrograms. They also did a study, they did a smaller study with 25 micrograms, seemed to be almost as good as 100 micrograms. So it's possible you could give a quarter of a dose of the Moderna vaccine twice. That would still be half the dose you were using now, or a quarter of the total 2 doses. So there's a lot of talk about that, because right now the demand for vaccine is far higher than the supply. So right now, if we had, I said this week I have 1,500 doses. This week we had 4,000 doses. We could easily find people who would want the 4,000 doses, including all these people here, the 85-year-old lady with the spleen problem and the 77-year-old lady in Reesport. There are plenty of people who would want the vaccine. The problem is right now there's not enough vaccine to do it. In fact, when we were on the call today and asked people the question was how many doses could you give in the next 7 days, there were far more doses that people could give in the next 7 days than we had to give them. And this was with 1,500 doses. So again, right now, the problem is not enough vaccine rather than not enough vaccinators or not enough people who want it. Now, we will maybe come to a point where we have more vaccine than people want it. So maybe by the fall, we'll have 4 vaccines out. There'll be plenty of vaccine around. There aren't that many people who want it anymore because all the people who want it already got it. And then we will have more vaccine than we have people who want to be vaccinated. It is possible, if both the Johnson & Johnson vaccine and the AstraZeneca vaccine got approved, the production of the Moderna vaccine and the Pfizer vaccine increased, so we were getting, say, 20,000 doses a week. If we were getting 20,000 doses a week, we would have trouble with enough vaccinators. But we are far, far, far away from that. In fact, it is thought that Oregon is only going to get about 30 or 35,000 new doses a week. That's not very many, right? Because there's 700,000 people who are over 70, over 65, or have underlying conditions. That's a lot, so at 35,000 new a week, it's taking a long time to get through that 700,000. So that's why all this talk about what could we do to go ahead and do more. But right now, I think we're doing well. Case count in Douglas County is low. Vaccine is starting to come in. We have a lot of really, really, really willing vaccinators. We have this big event set up for Saturday, which should be great. Again, there's no walk-ins for this. This is all going to be by ticket. And we're going to do that on Saturday. We should get all those people in there. Hopefully then the next week we get more vaccine. We finish up on 1A, and then we can start with teachers and other educators and other people in childcare. And again, once we do that, then we can start working on our seniors. And once we get enough people vaccinated, we really can beat this disease down. So I know I've talked about my dream. So my dream is that we get a lot of more vaccine that vaccine, which is somehow being delayed by Pfizer or Moderna, gets brought onto the market, that maybe we get one or two more vaccines and that we can meet the demand. And so the hope would be, thinking about holidays, Christmas and New Year's, very little vaccine. By Memorial Day, we would hope to have enough vaccine to have done our priority groups. By 4th of July, we would hope to do others. And then by Labor Day, we would hope to have gotten everybody's full dose again, whether 2 dose or 1 dose, regardless of what you need. And then you'd have your full doses done by Labor Day. Well, if 80,000 people in Douglas County got the vaccine, if the vaccine worked as we expect, and if the variants don't screw this up, then by next Labor Day, we could be back to a pretty normal time. Schools could open, colleges could open, we could have Ducks games. There would be no restrictions on bars and restaurants. Things would be great. Would we still have the disease? Yes. Nobody is thinking that this disease is going to go away like it's going to be totally gone. There are very few diseases that are totally gone, right? So smallpox is totally gone, but that took a worldwide effort. It was a particularly easy one to do because of the way smallpox is. We don't think this is going to be gone. We still think there's going to be some out there. But, if we had 20 cases in Oregon today, that would be not a big deal. I mean, it would be a big deal for the 20 who had it, but it wouldn't be a big deal. You'd have enough resources to go ahead and contain that. It's not going to overwhelm the hospitals. Right now, in places in the country, it's really overwhelming the hospitals. Again, a friend works down in the LA area. They said it's just ridiculous. Every day we're losing all of these people on the shift. They say they're losing, in Southern California, losing 1 person every 6 minutes. Yikes. So that's really hard. People are really exhausted. They've been doing this since Thanksgiving. And people are saying, look, you can only work 6 days a week for so long before you're just mentally and physically exhausted. So they've been able to do it. They've been not able to work, and they've taken vacation or leave, and there's nobody really to back them up because there's so many other places in the country that are having a lot of disease. Again, we're really lucky in Oregon. We have a relatively low amount of disease. We're incredibly lucky in Douglas County because we have a low amount of disease, and I think we're well on our way to getting to vaccines. All right, let's see if there's any. I'll do one more question. There are no more questions. Again, this is Dr. Bob Dannenhoffer, Public Health Officer, Douglas County. We'll do this again on Friday at 4 o'clock. And then we're actually going to have a special Facebook Live starting at 1 o'clock on Saturday. We're actually going to be at the event on the fairgrounds, and we're going to use the Facebook Live on Saturday to let people on the standby list know where they fit on the standby list. So we have 500 guaranteed slots for people with disabilities and home care workers and whatever, and then we have an additional 150 for people in that same group who are on standby. But if we get extra doses from the vials, which we think we will, or if we have no-shows, which inevitably happen, we'll call people on the standby list until we use up every little last drop of vaccine. And I will tell you, we're really down to the last drops of vaccine because we want to give it to as many people as possible. All right, no more questions. This is Dr. Bob Dannenhoffer, Public Health Officer, Douglas County. Thank you for joining us, and we'll do this again on Friday. Thanks.